is your question? Right. So if you have read and understood, considering it clinical examination station, kindly please begin.
Yes, so I will enter into the station, wash my hand, and greets the examiner. Hello, sir. Hello, ma'am. Good morning. And to the patient, hello, good morning. I am Dr. Ghanshyam, one of the surgical trainee. May I confirm your name and age, please?
Yes, 23 years old. Lisa.
Yeah. Yeah, nice to meet you. Today I have been asked to examine your shoulders. That would include the looking, feeling, moving, and performing certain tests. So are you okay with this?
Yes.
Yeah, and for the purpose of examination, I need you to expose both the shoulders, and I will have a chaperone to ensure your privacy. So is that okay for you?
Yes, but chaperone is not required for, not needed for this patient.
All right.
You can
All
ask,
right. And
you can take off the
yeah,
gown, but keep the
yeah,
undergarments on.
yeah.
Yes.
All right.
Okay.
And before beginning the examination, do you have any pain? Should I offer you any pain relief medications?
Yes, I have pain, but you can continue. You can do the
All right.
examination.
All right. Thank you. So I will start by having a close look at your shoulders. So I
What
will
would
look
be the
from the
position of the patient? How would you advise the
yeah.
patient to be?
Yeah, sorry. So for the beginning, the patient should be sitting on the chair. All right.
Okay.
Yeah. Yeah. So I will have a close look at your shoulders. So from the front side, I will look for the any skin changes, any scar, any swelling, any obvious deformity. And do you mind if I examine you from the back?
Yes, it's okay.
All right. So I will look for the same signs from the end. Now I'm going to feel your shoulders and I will be gentle with you. And if you have any pain or discomfort, please let me know. I will stop. All right.
Okay.
Yeah. So I will warm my hands and will first test for the temperature on the both side with my dorsum of hands. And then I'm going to palpate the bony tenderness. I will start from the sternoclavicular joint and then will palpate the clavicle and then acromioclavicular joint and then shoulder joint line and then coracoid process and will then palpate the scapular spine and muscles around the shoulder. And now we'll repeat the same thing another shoulder. All right, so that's complete the palpation. Now I'm going to move your joint, and if you have any pain or discomfort, let me know. All right.
Okay.
So could you please bring your both arms forward as much as you can and towards the ceiling.
Okay.
Forward flexion. Now, please bring your both arms backwards. All
Okay.
right. So that's the extension. Now, could you please bring your both arms away from the body as much as you can? So that's the abduction. Now, could you please bring your arms cross over your body? All right, thank you. So that's the adduction. And now, could you please do like this? So I will show the patient how to do the internal rotation and external rotation. All right, now I'm going to move your joints. All right, so now, ma'am, I will do the passive movement. So I will stand behind the patient and I will stabilize with my one hand the scapula and we'll test all the movement, flexion, extension, abduction, adduction, and internal rotation and external rotation. And we look for the crepitus present or not. And I will repeat the same examination on the other shoulder also. All right, so that's complete the movement. Now I'm going to perform certain tests, and if you have any pain, please let me know. All right. So first I will perform the empty can test. So please, can you bring your arms away from the body? I will position, and your thumb should you like towards the downwards. All right. And now I'm going to put some resistance, and you have to avoid me. All right. So I will do the empty can test on the both side. All right. So, okay. So now I will test for the impingement syndrome. So could you please bring your arms like upwards, and slowly you have to lower down your arms. Okay. Yeah. Okay. So that's the test for supraspinatus. Now I'm going to perform the I will ask patient to do the external rotation against the resistance. So that test the infraspinatus. Then I will ask patient, could you please put your back of hand over your low back? All right. Now I'm going to test, and you have to lift your hand from the back. All right. Yeah. So let's test the lift of test for the subscapularis. Now I will perform the same test on the other hand also, and then I will test for the hornblower signs. So I will abduct the patient's shoulder and put in external rotation. The arm will fall into the internal rotation. So that's the positive for the teres minor. All right. So now could you please say me if you feel like this? You feel this? Yes. So I will check for the sensation. Now you will close your eye and say yes if you feel this. All right. So I will check the sensation over the regiment's badge area for the
Okay.
axillary now.
Can you please
All right. Yeah.
summarize your examination? Thank you.
Yeah. So today I have examined this lady, 23-year-old, who is presented with pain in both shoulder, with more on the right shoulder. On inspection, there is no any skin changes or any scar mark or any swelling or muscle wasting. On palpation, there is mild tenderness is present over the right shoulder. On performing movements, there is a painful movement of the right shoulder is present. However, there were no any crepitus. On performing special test, the test for the empty can test and impingement test for the painful arc syndrome is positive,
Very
and
good.
rest of the examination were normal. However, I
Okay.
would like to perform the power of the deltoid muscle and
All
the
right.
serratus anterior muscle.
How would you confirm your diagnosis? What investigations would you ask for?
So I would like to first advise for the X-rays of the shoulder, AP and axillary lateral view.
Very good.
And if I suspect any rotator cuff tear or impingement syndrome, then I will also offer the patient for the either
There are
dynamic
two
USG
different
of the.
conditions. If you suspect impingement syndrome, then what would you do? And if you will consider a rotator cuff
Yeah.
tear, what
So
would you do?
if I suspect the impingement syndrome, then I will advise for the dynamic USG,
Okay.
musculoskeletal, and if
After your examination, what are your provisional and differential diagnosis for this particular patient?
Yes, so my first provisional diagnosis is the impingement syndrome due to
Okay,
subacromial
good.
bursitis.
Yes.
And other differential, I would like to give the either calcific tendonitis or rotator cuff tear or any traumatic injuries like due to trauma or due to.
Okay.
Yeah,
What are
yeah.
the management options that you can offer the patient?
Yes, so first I will give the patient some analgesia according to the analgesic ladder, and then advise for the rest for few days. And if then I will start the patient the physiotherapy and local ultrasound and shortwave diathermy. If patient's condition not improve, then second line treatment could be intraarticular steroid injections.
Okay. And how long, because patient is athlete, swimmer, How long
Yeah.
of rehabilitation would you advise the patient before patient can go and take part in the activities? Yes.
So I will advise for the patient till the all symptoms subside. So it usually requires 6 to 8 weeks.
That's too little, maybe more, because
Yeah.
patients both
Yes.
shoulders. Okay, how would you decide which shoulder to examine first?
Mm,
Patient has more pain on the right shoulder and less
right
on
shoulder.
the
Yeah.
left. Which one would you examine first and why?
Yeah, left shoulder, because patient may be more anxious, or if you examine first the right shoulder because of pain, and she won't allow you to examine other shoulder if you start from the painful shoulder.
Okay, good. Right. Thank you.